Kelly Clements, you are the United Nations Deputy High Commissioner for Refugees. Thank you, first of all, for being with us today in the context of the SGZ Media Zone that takes place every year in September on the sidelines of the GA General Debate and also on other different time of the year. Ms. Clements, the world has changed. We cannot even shake hands because of a microscopic virus that is spreading everywhere in the world, affecting all walks of life. How did COVID-19 impact UNHCR work, specifically that you are dealing with refugees who basically live in crowded camps where physical distancing and other safety measures are difficult to maintain?
Thank you, May, and it's really a pleasure to be with you. The last time I was with the SDG zone was in January, actually, here in Switzerland, and then with you at the General Assembly last year. And indeed, it's much different having a conversation over a screen than it would be at a desk, just a few feet from each other. And the world indeed has changed substantially in the last 6, 7, 8 months. We did not anticipate the kind of challenges that we would have faced in January of this year. Of 80 million forcibly displaced people around the world, the majority actually live in urban areas. They're living right next to citizens of that country. And I think very quickly on, governments and communities realized that in order to protect the health of their communities, they needed to protect everyone in those communities. So we worked very quickly. Clearly, the Secretary General, the instruction was to the extent possible, we were going to stay and deliver. And our teams, we have about 17,000 people in 130 countries in 500 different duty locations. And there was a strong duty to serve. So really turning on a dime, our operations worked very quickly with governments, with local communities to try to put systems into place, information campaigns about hand washing, about good hygiene. Fortunately, we had many of those programs already going, but really reinforcing with quarantine areas and isolation facilities and strengthening some of the health structure that governments have. But we, in the work that we do around the world and in those areas where you talked about camps and some of the more remote locations where we may be supporting governments in terms of a camp situation, in 36 countries, we actually provide the direct support in terms of health care, prevention and response as well. So we worked quite quickly within the system, and the collaboration, I have to tell you, amongst the UN and the many partners that we work with has been nothing short of extraordinary. Working to support the government response, making sure that refugees and internally displaced people were included in every aspect of that response.
Deputy High Commissioner, I know, unfortunately, women and girls, refugees, face additional hardship when in camps. They have witnessed discrimination and violence against them simply because of their gender. How did the pandemic exacerbate the life of this vulnerable group?
Yes, well, indeed. And I think this is where you get to some of the areas in terms of the pandemic that, of course, we understand, but we also are somewhat concerned about. You know, there have been serious restrictions with regard to movement of people in lockdown, borders closed, etc. We saw it at really the top of this pandemic that over 130 countries had put some kind of restriction in place in terms of movement or access to territory. Now, there have been some exceptions made for asylum seekers, and that, of course, we welcome, but there still are, it's excessively difficult for people to be able to get to a safe area, to get to a safe country when they're fleeing violence and persecution and conflict in their communities. Now, women and children, of course, are the majority of the people that we serve and the majority of those refugees that cross borders and move internally in a country. And with the 4 out of 5 people that we serve are women and children. This makes the issues related to protection doubly acute, you know, both in terms of not being able to get to a safe area, but once they are in that area, how do they access the facilities, or how do we help to help them prevent themselves from sexual-based violence, for example, gender-based violence, And then if something happens, how do they access the services in terms of support? Now, we have found that 1 out of 3 people, and this was pre-pandemic, but the risks are far greater in the pandemic, suffer from gender-based persecution. And now this kind of violence, of course, we've seen is not necessarily followed up by support. 40% of those women and girls that have been subject to violence are not stepping forward for the kind of support that they need because they worry about stigma, they worry about retaliation. And so we've had to, in the pandemic particularly, look at this as heightened risk, but also try to change very quickly some of the programs and ways that we access communities, using technology, using community health worker or community protection workers. Refugees become on the front line in situations like this in terms of being able to identify risks, but also being able to help those that are in the midst of these difficult circumstances. In addition to that, the pandemic has changed the economic landscape completely. In every facet of our community we're seeing globally, the inequalities have increased. So for example, those women that had employment in some way, people are losing jobs, and refugees and displaced more than most are dependent on the informal sector in terms of employment, in terms of cash. So the risk is quite great that we see, for example, women and children turn to survival sex or child marriage or other ways in order to be able to support themselves and to support their families. And this is what we want to make sure doesn't happen. One other key element we've seen, May, is the impact on education. And clearly this is not specific to refugees and internally displaced people, because we've seen, of course, schools closing all over the world. But we have calculated that there are 5.8 million refugee primary and secondary students that are now out of school completely. Their schools have closed, or somehow their ways of learning and being educated are no longer possible. This added to over 2 million refugee kids that were already out of school. This is something that we are extremely concerned about. In addition to that, of course, you see some of the studies that we've done with the Malala Fund have indicated that those girls in particular that are out of school, there is a risk that half of them will never go back. So we've made some gains in education over the last 3 years. We want to make many more gains, but the pandemic really risks setting us back in terms of learning and in terms of education.
Ms. Kelly, since we're talking about women and girls, and since we are celebrating 25 years on Beijing Declaration, which was a historic turning point for advancing the rights of women, I want to ask you first, what are your thoughts about this declaration?
You know, Beijing Plus 25 was really a landmark in terms of equality and equity and gender. It brought the gender issues really to the fore. And of course, there was a very strong component with regard to people that have, women who have fled for reasons of persecution, refugees in particular. And what Beijing did in terms of some of the complementarity we saw 2 years ago when the Global Compact on Refugees was adopting, put a strong focus on gender equality and the importance of putting women in control of their own decisions, women in leadership positions, and women really articulating and having the same rights that men do. And this is something that we have integrated into every aspect of our programs. When programs are being designed, it is extraordinarily important to keep refugees and displaced at the center of those decisions, making sure that there's strong representation from women in those decisions, that they are able to register themselves as individuals, that they're able to articulate what they need in terms of aid and support. This has a ripple effect, of course, in terms of being able to rebuild a community when we hope that it's possible for people to be able to voluntarily go home, or build the communities again in those areas where they have found themselves because their families were not safe in their home countries or communities. So this is an extraordinarily important document for us. It's been a signal that has then rippled through what we have done since then in terms of gender equality in UNHCR.
You just mentioned programs. I want you to speak a little bit about those. What program did UNHCR put in place in line with this declaration to help women refugees survive, but also thrive and come out stronger?
You know, in fact, we've done this across the board in terms of, it was back in the early 1990s that UNHCR actually established its first policy on refugee women. And we've come a long way since then in terms of making sure that the way that we design, we implement, and the types of, that we're not talking only about legal protection, but also physical protection. In those early days, there was a lot of discussion about when, for example, you're setting up a community, how do you make every member of that community safe? Now, it's far from us to say what safety means to an individual, but it's including women in actually that design, in articulating the needs of their community. And that is, from a program point of view, we have a very important approach called Aid, Gender, and Diversity. And it's really putting people at the center in terms of articulating needs and then being able to implement according to those needs with strong feedback throughout the life of a program. So I wouldn't say that there's one program, because it's really the entire way that we look at how we can best protect and aid. And that has been an extraordinarily important part of our work.
I want to touch upon your resettlement program. You have a big resettlement program for refugees in UNHCR. I would like to know how did you maintain it during COVID, especially amid the restriction inflicted by COVID?
This, in fact, resettlement is, as you know, a solution for a very, very small number of refugees around the world, the most vulnerable of the vulnerable. It's a lifeline, really, for individuals that have no other choice but to be resettled to a third country. And we have several resettlement countries that have been very generous over many years. Now, the pandemic, and I mentioned, May, earlier, the restrictions, travel in many locations was not possible. Borders were closed. It was very difficult to be able to bring people out of communities to be able to for onward movement. And so we temporarily made the decision to suspend resettlement for a period, but not too long ago have actually recommenced. During that period, there were movements still happening, but very small numbers. We have since seen several countries step back in terms of resuming more of the normal resettlement transport and processing. And throughout, we have continued to identify those in need of this form of international protection. And we've used the pandemic to in some places, actually pilot different ways of being accessing those applicants. Or those people that we've identified for potential resettlement. Interviewing, for example, like you and I are on a screen. There are several countries that have actually done their asylum processes remotely or virtually. And so finding ways that we can continue to make the program work and get people ready for travel and so on, even if it's not physically possible to get on an airplane and go to another country just yet, as the pandemic continues to evolve. So we're very much hoping that the resettlement program will come back, will be, again, a healthy mechanism for those that are in need of this form of international protection, because we do, in fact, with responsibility sharing, there are countries that want to open up their homes and borders in terms of bringing people in need of international protection to them. And there are obviously refugees that are deeply in need of this form of international protection.
Ms. Kelly, in the face of this pandemic and on the occasion of 25 years on Beijing Declaration, what would you ask world leaders to do? What message would you like to say to the international community?
You know, we are at the world's really, unfortunately, record levels of displacement. This pandemic comes on top of an emergency of forced displacement in terms of the inability of people to stay where they are for war, for persecution, for conflict. We need now more than ever the solidarity of the international community to help to protect, provide assistance and support to communities in great need, along with those communities that have been generously hosting them. Really now is the moment, and we can't take our eye on the most vulnerable of the vulnerable, the marginalized, and as inequalities increase, we need to make sure that we have included forced displaced, the refugee population within our programs and policies in the international community so that all are safe.
Ms. Kelly Clements, the United Nations Deputy High Commissioner for Refugees, thank you so much for being with us today, for speaking for refugees and for women. And for that, I'm very thankful. You're a role model for women like me. Thank you for doing the work that you're doing, and good luck with any future programs. Thank you.
Thank you, May.